if patient has tuberculosis 2 years ago and now he is completed the treatment and medically he is fit and fine. So can we proceed the routine extraction, or do we need anything like physician consent for that also?
In tuberculosis, what is the risk factor to the dentist or to the operative? Right, if the patient is having active tuberculosis, then there is a chance it's a contagious disease, no?
Right.
It's transferred through the sputum or the droplets also.
Right.
So in such a case, generally we advise a sputum culture test, no?
Sputum culture test,
no? Or the AFB test, no?
Yeah.
They take the sample of the sputum and they culture it. If they see the acid-fast bacillus or the tuberculum bacillus on that, so they consider it's a TB positive.
Okay.
Right? If and the sputum test is positive, we should avoid such a cases.
Okay. For basic root canal also.
Because it's during the root canal, you are using the aerotor, right? And whenever you use the aerotor, there is a aerosol formation. So generally, saliva is we see that aerosols come on our face or our mask. So such a patient you should avoid it. But in your case, your patient is already taken the regimen for the tuberculosis 2 years back.
Right.
So generally, in such a patient, disease is in inert form. But if patient is giving a history of the tuberculosis and such a regimen is taken, generally they are safe to do a procedure. But if you advise them to do once sputum test before, that is the best way to prevent yourself and your operatory also, right? Because your assistant, right, your sister, yourself, right, or your other operatory will also get contaminated, if the patient is having active tuberculosis, or so this is the consideration generally you should take it.
But there are some patients who used to hide their medical history. So in such a case, like what are the signs and signals that we should have to take a precaution?
See, generally if patient hides their disease, we are not able to do anything. Right. So that's why generally I always tell my students, you should do two things perfectly. One, you safeguard yourself, right? You should do your universal protocol. You should use your universal protocol, right? You should cover your head during procedure. You should use your surgical mask. If possible, during COVID time, we know how to use a PP or the thinner PP. You can use the universal protocol. In a patient you are suspicious, you are thinking, so you should use it. Or the sterilization protocol, your operator should get formalin fumigation, right? These things you should do it. And the second part, you should take a history multiple times and in details. You should not take a history like do you have any disease or not? Like one sentence, patient is saying yes or no, that's it, finished. It's not like that. You should ask them whether you have admitted before or not, whether do you have any disease at you or in your family, are you taking on multiple medicines or not, do you have any habits or not. So when you talk more, patient generally tells. Right? So generally you should take care of yourself with the universal use of protocol, and the second one is you should take a case history in detail. So this thing you should follow also.
What if unconsciously patient, doctor had did that patient and later on patient are saying he has a history of TB and ongoing the medication. So what are the precautions now doctor can take, dentist can take?
See, now
because he or she has already performed the patient.
So patient is generally you have performed the procedure on the TB positive patient, and patient told you after the procedure, right? So generally TB is a disease where the patient, if you are having a low immunity, then only you get it. No, it's not always key. If any tuberculosis patient come to you multiple times in Indian scenario, patient having multiple disease, but you are not get it. No, it's a immunity based also. No, if your immunity is good, generally you are not able to do it, not get it. But if the patient is telling post-operatively they have a positive TB test just recently, and you have performed the root canal or the extraction, so you should check yourself AFB test
as a dentist.
Yes, AFB way after the 7 to 10 days. Then you should take. Are you developing any kind of symptoms like the regular coughing, sneezing,
Can you please
weakness.
repeat the test name?
AFB,
AFB, okay.
Yes, acid fast bacillus test, no?
Oh, yes, yes.
That is a common test, no?
Okay.
So, meanwhile, you should talk this scenario with your MD medicine or family physician also.
Right.
Sometimes they know your body structure and you are prone to which diseases. So, according to they, after 10 days, if you develop any symptom, then they will start a regimen to you. Also. But as you are young or the younger, as we are having good immunity, generally we don't catch it. But if catch it, these are the protocols you should follow.